Okay, folks, now discussion D is the last one for tonight. We're discussing what Medicare, Medicaid both cover for hospice care. Okay, so we're going to go through that tonight for D. So please join me in tonight's presentation D. Here we go. Medicare and Medicaid both provide coverage for hospice care, but the specifics vary between the two programs. Okay, Medicare coverage. Medicare approved hospice programs cover costs related to pain relief and symptom management for terminally ill or terminal illnesses. Coverage includes treatment from hospice doctors and nurses, therapy services, home health aides, medical equipment, prescriptions, nutritional guidance, and grief counseling. Medicare typically covers hospice care up to 6 months, but patients can continue receiving care if their hospice doctor recertifies their terminal illness. Okay. Medicaid coverage. Medicaid hospice benefits aim to provide comfort and care during the final months of life. Eligibility. Give me 2 seconds, guys. Requires a physician's certificate of terminal illness, through each state sets its own life expectancy criteria. Medicaid hospice care is distinct from palliative care, which can provide for serious illnesses without requiring a terminal illness diagnosis. Medicaid hospice benefits vary by state, but generally cover services needed to manage a terminal illness. Medicare hospice coverage is designed to support individuals with terminal illnesses by offering care focused on comfort rather than creative treatments. Here's an overview. Eligibility requirements. The patient must be enrolled in Medicare Part A. A physician must certify that the patient has a terminal illness with a life expectancy of 6 months or less. The patient must choose hospice care instead of treatments aimed to curing their illness. Aimed at curing their illness. Services covered. Medicare approved hospice programs cover a range of essential services, including medical care and support from hospice doctors and nurses, pain relief and symptom management, therapy services such as physical, occupational, and speech therapy, home health care aids for assistance with daily activities. Okay. Medicaid or medical equipment and supplies related to hospice care, prescription drugs for symptoms control, nutritional guidance and dietary counseling, emotional and spiritual support, including grief counseling for the patient's family members, duration of coverage. Hospice care is generally covered for 6 months, but patients can continue receiving care if their hospice physician reevaluates and certifies their terminal illness. Okay, would you like details on cost and how to enroll in hospice program? Medicare hospice care is mostly covered with only a few out-of-pocket costs for patients. Here is a breakdown, folks. Routine hospice services. Medicare covers nearly all hospice-related costs, including medical care, nursing home, health aid services, medical supplies and counseling, prescription medication. Patients typically pay a small copay up to $5 per prescription for drugs used to manage pain or symptoms. Respite care. If a patient requires temporary care in a Medicare approved facility to give their family caregivers a break, they may pay 5% of the respite care costs. Room and board. Medicare does not cover room and board costs in hospice facilities unless the patient is receiving short-term respite or necessary inpatient hospice care. Okay. Would you like help finding hospice provider or understanding additional financial assistance options? Okay, guys, so those are your shows for tonight. I'll see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Have a good evening. See you tomorrow for shows.